Hello, everyone. My name is Agatha Morello, and I'm a postdoctoral resident at the Mailman-Siegel Center Developmental Assessment Clinic. Today, I'm going to focus on talking about parent-child interaction therapy, PCIT, and I'm going to focus on discussing the PRIDE skills. So what are the objectives for today? I want to be able to define PCIT and really discuss that child-directed interaction. I want to also be able to define and explain each do and don't skill for you all and make it very clear as to what we're looking for in these interventions. I also want to be able to utilize the PRIDE worksheet to implement the child-directed interaction strategies, right? So I'm hoping that through this training, you are able to, pick up that worksheet and feel comfortable in either implementing yourself with your child or implementing it with the caregiver or the parent that you're working with. I do want to note that all the resources that I will be presenting today, all the information, were adapted from the UC Davis PCIT website. You'll find the link here. And again, at the end, I will talk about where to find all the resources that I've been using throughout this presentation. So what is PCIT? It is an evidence-based treatment. It was developed by Sheila Iberg, and it's used with children between the ages of 2 and 7 with behavioral, emotional disorders. These are children who maybe have a difficult time complying. Maybe they had a difficulty, an underlying difficult attachment with the parent or caregiver, and it really places that emphasis on improving the quality of that parent-child relationship and changing the parent-child interaction patterns, okay? And these are split into two different treatment phases. We're gonna have the child-directed interaction, the CDI, and the parent-directed interaction, PDI. So as we know, most of the time when children are playing or interacting, it's very hard to sit back and just let them lead. A lot of the times I'm finding in my work that parents will jump in and try to help the child out, help them expand their play or help them with their vocabulary. And what we really want to do is step back, give a chance in this child-directed portion, and give them a chance to express themselves. Because as we know, when children have feel heard and understood, that increases their self-esteem. And today, I'm going to focus out of the two. I will just be discussing an overview of the benefits of both, but I will be emphasizing on the child-directed interaction. So what are the goals of the first phase, right? What are the goals of the CDI? We want to see a decrease in the frequency, severity, and duration of tantrums, right? We want to see the decrease in those activity levels. We want to see a decrease in those negative attention-seeking behaviors. So this could be whining, crying. Sometimes we see children even act bossy during play. Hopefully, we're hoping to decrease parental frustration, and we want to increase the child's feelings of security, safety, and attachment to the primary caregiver. And what we're hoping is as we are playing and engaging with the child and engaging in all these techniques, we'll see the activities level decrease because they're sitting with us for longer and they're attending longer to the activity that we're engaging in. And like I mentioned, you're going to end up seeing an increased level of self-esteem in your child. You're sitting back, you're letting them take the lead, and you're showing that you're interested. We also want to see an increase in pro-social behaviors, right? So we want to increase the ability to share and take turns. In terms of the second phase, what we're trying to do is we're really trying to equip parents with the confidence in their ability to be able to redirect behaviors, right? We're going to see hopefully a decrease in frequency, severity, and duration of aggressive behaviors, a decrease in the frequency of destructive behaviors, so breaking toys on purpose, throwing objects, right? We want to see a decrease in defiance. So if we've already established a good foundation of a relationship, now when the parent comes in and gives a directive, they are more likely to comply with adult requests, right? We also want to increase those respect for the house rules that the parent might have. Improved behavior in public is what we're hoping to see as well in the second phase, and increased parental calmness and confidence, right? So we really want our parents to feel confident at the second piece in order to implement those interventions. And like I mentioned today, I'm going to focus on the first portion, which is the child-directed interventions. So PCIT, what does that actually look like? What are those sessions like? We have coaching sessions, right, where you have a parent and a child in the playroom. And what you're going to need for this is a room that allows for the therapist to be able to look in, but the child cannot see the therapist. So we're hoping you have maybe a two-way mirror in order to engage in these sessions. So the parent and the child are in the playroom while the therapist is in an observation room, and they're watching that interaction either through that one-way mirror or even sometimes a live video feed. And what's happening in these sessions traditionally is you'll have the parent in the room with the child, and they'll have what we call a bug in the ear, which is like a tiny little earpiece, where I, as the therapist on the other side, am coaching the parent as to what to say and what to do, and they are following along my instruction. Okay, and these are about 1 hour sessions, one time a week, and in total it ranges, so it's about 12 to 20 sessions. You know, treatment for PCIT really isn't time limited. What we're hoping for is to, you know, at this point between 12 and 20 sessions, we're seeing improvement, we're making our way towards growth. I do want to talk about certain adaptations to PCIT. So the true PCIT sessions look like this. Sometimes you could do what's PCIT informed, where you're following the same structure, but for whatever reason in the facility you don't have a one-way mirror, you don't have an observation room, there's no ability to do live video feed. And what I've done in the past for my sessions is I've been in the room with the parent and the child, and now I've made sure to differentiate myself and maybe sit back a little bit, watching the parent and the child engage, and every once in a while really sitting up close to the parent and being able to direct them as to what they're doing. So I found that helpful as well. What I've also done as terms of an adaptation or a supplemental for PCIT is what you'll notice is PCIT sessions really are the parent and the child together in the moment. And what I've noticed in my experience is a lot of the times parents require additional support. Either the skills are overwhelming at first to do, or it might take them a little bit longer in order to master the skills to implement with their child. So what I've done in my past settings is I've done the PCIT, the coaching sessions, but then I'm also doing an additional 1 hour a week parent training session where it's just me and the parent, and I'm going through what you're going to see now, the different skills, and I'm role playing with them, I'm troubleshooting what it would look like with the child, and I found that parents find that very helpful as well in order to master these skills with their children. So here I have some discussion questions that I wanted to touch upon, right? So how would you approach play with a young child? And I want you to take a minute and reflect to yourself as to what does that look like? And I'm just going to talk about what my experience has been working with children and then working with parents, you know, new parents, skilled parents. I think that the way that a parent or an individual approaches a child reflects a lot about their own level of comfort with play. And what you're going to see is someone who's maybe had more experience playing with a parent or playing in general and still is very in touch with that piece of theirs. It's a lot easier for them to jump into that pretend role and engage with their child. A lot of times what I'm seeing is maybe a parent has either had multiple children who now the children are playing with each other and they don't really engage as much in play, or maybe they've lost touch with that sense of themselves, and it might be harder for them to enter that play role with their child. So again, this can be in varying degrees, but I want you to take a minute and reflect on yours. And then the next question is, what would be challenges that parents experience playing with a young child? And now I've mentioned a couple of them already, where maybe you have a parent who hasn't played in a long time and it might be hard for them to jump into that pretend role. It might feel silly. You know, I've worked with parents who really either they feel really uncomfortable or very awkward playing with their child because they don't understand how. I've also had parents who, for lack of their own experience with play, I've worked with individuals who are from immigrant families, and you know, at the age of 6 they were expected to be working on the farm and helping their parents, and there was no longer room for play and it was work. So they had a very limited repertoire of play skills. And that can, you could see how that can play a barrier with engaging with your child. I've also seen the opposite side where sometimes parents, they use the time of play as a time for teaching. So it's a very thin line between being an instructor and hoping that your child increases these skills of letters and numbers and sounds and labeling animals versus really just letting go of the structure and having a fun time and engaging with your child. And the issue that I see sometimes is that parents, they have a hard time staying within that line, and they kind of teeter-totter between, okay, I'm having fun, but now we need to be able, can you identify this animal, and this animal? So it takes away from that piece of enjoyment, and I'll talk about that later. And then how would you approach, and the last session is, how would you approach teaching a parent how to play with their child? So for those of you who are watching this and who are mental health therapists or individuals working with families, you definitely want to be gentle. You want to be humble. I think for me, it's just the parent is the expert on that child. They are going to know way more about that child than you will ever know in that 1 hour session that you're with them a week. So you definitely want to always, come back to that, asking them, is this okay? How do you think your child will respond? And really making them feel involved in the process of teaching them these skills. You also want to be gentle in terms of the feedback. I think there's a lot of strengths that come with parents, and even the motivation to come in every single week and learn these skills, take the time to role play with you. I praise that all the time. And I definitely like to highlight those strengths for the parents that I work with. So let's talk a little bit more about playtime. What does that look like? So here you're going to see a long list of different toys that we use during the PCIT playtime. And what we're hoping for is to have creative and constructional toys. And what's going to happen is when you look at this list, these toys lend for a couple of things. They lend for creativity, right? So we want our children to be able to expand on their play themes. And then we also want them, we want opportunities for them to engage with others. So whether they have to share those Duplos or Legos, right? Or whether they have to take turns with the Lincoln Logs because you have the box and everyone needs to take a turn. So we definitely want to have toys that can not only increase the creativity, as you can see here on this list, but you also want toys that will lend for that social aspect where we have that back and forth. Unfortunately, things like puzzles, coloring, even though that's a fun activity that you can engage with your child or the parent can engage with the child, we definitely want items where there can be a back and forth interaction. Okay, so what does the relationship enhancement, right? So what are these do skills that I was talking about? And as you can see here, it's into the acronym of PRIDE, right? So we have praise, we have reflect, imitate, describe, and enjoy. And all of these skills together make up what is called the PRIDE skills. And this is what we want parents to do in the session with the child, right? And when we use all these skills together, this is really lending into enriching that relationship between the child and the parent. And what I've done in the past, and like I mentioned, I do separate sessions with the parents. And what I've done is I've really just broken it down for the parents and teaching them each single step and making sure that they understand each one before moving on to the next. Because you can see, as I start to discuss them, how a lot of times they build upon one another, where you can do, and then sometimes you could be doing two at the same time. So we want to make sure not to bombard and overwhelm our parents and make sure to take it very slow and just focus in the beginning on one at a time. So let's start with praise, right? So praise, we want to praise the appropriate behavior, right? So what do we know about praise? This is going to increase those desired behaviors, right? How do children know what we want from them? How do children know what we want to see? We let them know we like what they're doing, right? And when we praise someone, so great job, Timmy, we want to make sure to be specific. We want to say thank you for picking up the, excuse me, picking up your garbage. Thank you for turning off the light. I'm proud of you for finishing your homework before dinner. I like how you're sitting still in the table. We want to be very specific. And what we end up doing is when we're giving children this praise, we're really just like shedding a light. We're really highlighting all the positive behaviors that they're doing. And this is going to increase their self-esteem. They're going to feel like, whoa, oh my goodness, you're looking at me, you're attending to me, I'm doing something right. This is going to add warmth to the relationship, right? And this is also models that positive social behavior. So not only are we praising them, but we're hoping one day they can praise themselves, they can praise others, and this really makes the parent and the child feel good. So another thing that I want you to consider with praise is, you want to praise every small step towards the ultimate desired behavior, right? So here, thank you for handing the toy back to your friend, right? So this is a child who grabbed a toy and is working on taking turns. So, you know, right away, we're not going to expect children to know how to take turns if that's the ultimate goal. But the fact that they were able to hand it back, which is the first step of taking turns, we want to be able to do close approximations. Here are some other examples of praise. Again, being very specific. I like the way you're playing so gently. You have wonderful ideas for this picture. I'm proud of you for staying calm. You did a great concentrating on building the garage. Thank you for sharing. So really highlighting and letting children know, what do we like? What do we want to see more of? And ultimately, when you praise a child, they like praise. So they're going to want to do that behavior again in order to continue to receive praise from you. The next step is reflect, right? So here, reflect, you want to reflect the appropriate talk. And what it is when we're having a conversation with a child, and I've seen this sometimes with certain parents, is a child is trying to have a conversation with a parent, and the parent is almost like taking the lead in the conversation and making sure to ask them certain questions, get certain answers from them. And I think that's great in terms of teaching children skills, language skills, but this is really going to allow them to lead the conversation and make them feel, again, heard and understood. It shows them that you're listening, right? This is also going to help improve their speech. A lot of times what I've seen with reflection is, you know, a child will perhaps say something that maybe they don't know how to pronounce something yet, and even the mere reflection of reflecting it in the appropriate way is a very gentle way of showing a child, hey, look, you said this wrong. This is how you said it, but I heard you. I heard what you said. This is going to increase their social communication. It's really calming towards anxious children as well. And like I said, it's a non-critical way of correcting them. So some tips for reflecting. So when you think about reflecting, you want to be able to repeat what the child has said to you or rephrase it in your own words, okay? So this could be, you know, immediately repeating back what you heard, or even shortening it if you feel like it was something that can be shortened and paraphrased. So here, for a child with an articulation or language difficulties, like I said, repeating it using the correct pronunciation can be a very effective and gentle form of correction. So here, the example, the child, I did it all by myself. The parent, yes, you did it all by yourself. So again, reflecting right back what we heard. The child, I do a blue flower. So here, the child is maybe having a hard time with the L sound. So the parent is reflecting back appropriate, but, you know, modeling the appropriate language skills. So you drew a blue flower. The child, I'm tired. Parent, you are tired. So when I want you to think of reflecting as literally just mirroring back exactly what your child is telling you. Okay, so now we're going to do some practice, okay? And I want you on your own as I'm reading these to start thinking of what it'll look like, and I'll give you the answer at the end. So the first child says, and then the Spider-Man went up the roof off the tower and went psh, 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 and got the bad guy. So I want you to take a minute, think of how you would reflect that. Okay, so now that you got that in your head, I'm going to do it my way, but again, this can be done in various ways. You can either repeat back or you can paraphrase. So the parent would say, oh, wow, so the Spider-Man went up to the roof of the tower and he got the bad guy. So here, what am I doing? I'm paraphrasing what he said. I'm correcting roof to roof and tower to tower, right? I didn't really focus on the psh, that was more of a sound effect, but I did paraphrase that I understood Spider-Man got the bad guy, right? And then child B, look, I drew a butterfly. Take a minute, think about what you would say. So I would say, wow, look, you did draw a butterfly. Again, just really reflecting back. So the next skill is imitate. And what we want to do with imitate is we want to be able to copy, right? We want to imitate the appropriate play. This helps the child feel important. If they see that you're following along and you're imitating what they're doing, it's almost like shining a light on their play. Rather than sometimes, like I said, some parents will try to take over the play and expand the play in a different way. It also shows that you're approving of the way that they're playing, right? So if you're imitating an appropriate way of playing with something, so if they're playing with little animals, for example, and the animals are on a journey and they're walking through, let's say walking through a puddle and they're swimming, you know, imitating, you take your animal and you're swimming right alongside them, right? So you're kind of showing them like, I like this game, like this is a good game. So it also models and increases those desired behaviors. So whether that is using toys appropriately, you know, being able to not throw, and this is good for children who maybe have a hard time, like, you know, they get frustrated and they throw toys or they're destructive towards toys. So this is going to increase the ability to not become destructive towards a toy if they see that you're modeling the correct way of playing with them. This is also going to increase the child's imitation of what you do. So it's interesting that I see a lot of parents in my work who, you know, are very focused on like, I'm going to show my kid how to play this the right way, right? And I'm thinking of something abstract such as Play-Doh, where a child really can do whatever it is anybody can do anything with what their imagination lends for while playing with Play-Doh. So when I think of using imitation with Play-Doh, a lot of times what I've seen is a parent, you know, a child will be making like a squiggle and will say it's an octopus, and a parent will say, well, no, look, this is how you do an octopus. And I understand we're trying to teach children the skills, we're working on their motor skills and whatnot. But with imitation, what you're doing is it's maybe a more gentle way of them end up copying you, right? So let's go back to that same example. They're doing a squiggle. They show it to you and you're right alongside them, you're imitating them, right? Because it's an appropriate play behavior. They're not eating the Play-Doh, they're not throwing the Play-Doh, and you're rolling up that Play-Doh right next to them. And you're, oh yeah, look, it is, mine is an eel, right? Or look what I'm you know, you're imitating exactly what they're doing. And then as you're copying them, then you start putting your pieces together. Maybe you'll take another leg and you'll make it look more like an octopus. And the child will start referencing to you and looking to you and trying to model you as well, imitate you as well, right? Just some tips for imitating. So imitation is a very effective way to give attention to those appropriate behaviors and build upon those interactions, right? You want to see if you can draw attention to a child or help the group to include a child through imitating their play. So a lot of times what you'll see, and this could be either with children with multiple parents with multiple siblings, or even in preschool settings, is you'll have like a group of children or certain children playing together and one kind of being off on the side. This can really help the outsider child join the play if you start, if you're showing them how to imitate and they start imitating as well. Here's an example. It says, parent, I'm going to tap the blocks quietly, just like you. So here, in this example, the parent is narrating what they're imitating. And then here as well, the parent, we're driving our trains on the track. So again, they're narrating what they're doing together. We're both driving our trains on the track, and I'm sure they're imitating that. Okay, So some discussion questions just for you to reflect upon. So what are some challenges that you may face when teaching a parent to imitate their child's play? And then for those of you who are parents and are watching this, what might come up for you when you're trying to imitate your child's play? So I want you to take a minute and think about that. So what are some challenges? In my experience, sometimes, I think parents really get caught up in trying to show them the right way of playing with toys rather than just basically imitating. A lot of questions I've gotten from parents in the past is, but if they're doing it wrong, why am I going to imitate it? So always going back to the thought of, is this an appropriate way to play with the toy? Not is it correct or incorrect, is it appropriate, right? So again, for that Play-Doh, are they stuffing that Play-Doh in their mouth? No, they're rolling it out and pretending that it's a squid or an eel. It might not be exactly a squid or an eel looking, but it is appropriate because they're pretending, they're using it as Play-Doh's intended to be used. So that might be some challenges when imitating. A lot of times, when I talk about parents who maybe have a lower repertoire of play skills, imitating might be hard. They might feel silly. It might be like, oh, I'm playing, this is kind of weird, or I'm being silly, this might be a little out of personality. So you definitely want to make sure, and for those of you that are watching and are parents, this is normal. I think this is something that we can normalize for everyone. It does feel a little silly, especially some of us who haven't played in a really long time, and that's okay. And I think really, if the concern is that you look silly or it'll feel silly, I think seeing your child's enjoyment when you are imitating them is just, it's so rewarding. And at least in my experience where I've had to be silly and imitating a child, it really just brings down those feelings of like embarrassment or shyness, because I'm focusing my energy more on like, is this child having a good time with me while we're playing? So how would you know when to use the imitation skill during the session? So this is a good question to reflect upon. And a lot of parents, like I said, you'll see a lot of these skills can be used simultaneously, right? So we can be imitating and praising at the same time, or imitating and reflecting what the child is telling us. So I think I'm going to leave it up to your discretion in terms of, when I'm talking to parents, to know when to imitate, right? And as well as when you're a therapist, really working on the skills of the parent and meeting them where they're at. Imitation can be used at any single point that the parent feels that the child is engaging in appropriate play. It doesn't have to take up the whole session either, because you want to give room for the child to imitate the parent, and the parent to also, lead a little bit more of the play. But you want to work with where you're at and know, imitation can happen whenever. There's not really a requirement for how often it needs to happen during the session. Okay, so the next skill is describe. So here we're going to describe the appropriate behavior. And what does that look like? So when we describe the appropriate behavior, we're increasing the concentration and the attention to the activity, right? So we're really describing what is it that the child is doing with their hands. What do we see them doing? And now this is different from reflecting, because we're reflecting back what they're telling us, versus describing, we're narrating almost what it is that we see them doing with their hands. And how does this work in terms of concentration and attention? If the child sees that we, the adults, are focused on what they're doing on their hands and we're describing them, they will be most likely to continue to attend and sit and concentrate on what they're doing, right? It also slows down the active child. So this can be a child who has a hard time staying seated. If we're describing what they're doing with their hands, they might be more likely to continue to engage it and reduce that activity level even further. It teaches vocabulary for desired behaviors, right? Again, how do children know what we like to see from them? When we're describing the appropriate behavior, we're letting them know. And this can be used in conjunction with praise. This is going to increase the child's mindfulness. So when we think about mindfulness, we're thinking about really being in the moment and being present as to what we're doing. And when we're describing what the child is doing, in that moment, we're really shifting their focus onto themselves and helping them be in that moment of what they're playing with. And as well, this is going to end up maintaining the child's interest, right? So just some tips: you want to avoid describing the characters. You want to focus on the child's actions. And I think this is probably maybe the hardest skill to differentiate, is being able to describe, what the child is doing with the lion or with the toy rather than what the toy is doing. And, it happens to me as well. Sometimes it's a lot easier for me to describe, oh, little Peppa Pig is going to the market, versus, oh, you're using Peppa Pig to go to the market, right? So shifting the attention back on the child is what we want to do. So here's some examples on the side. It says, you're putting the toys back one at a time. You're keeping the Play-Doh on the table. And this is a popular one that's used in the preschool I work at. You're sharing your animals with me. So again, highlighting what they're doing. You're rolling out the Play-Doh very carefully. So really just describing what it is they're doing in the moment and what it is that we like to see them doing, right? And when we're describing, when you think of all these examples I just came up with, it's going to help them be able to continue to do that, because we're showing them, hey, I like that you're doing this. Okay, and then the last skill is enjoy. And when we think of enjoy, this is just going to demonstrate that we're interested in what the child is doing, right? And a lot of times, this skill, it could be a little bit hard in session to teach the parent. I think a lot of times, and this is for everyone. We're busy. We might have a stressful day at work. We might not come home and we're not in the mood to play with our child. And definitely one thing what I'm hoping that either parents or individuals who work with parents can encourage them to do is taking some time, to take a break. If you've had a stressful day, if it's been a rough one, take a moment to relax, calm down, engage in some self-care. And that way it'll be easier for you to enjoy the time with your child. And I think one of the big, one of the things that we need for PCIT to work is for the parents to be open to the experience, to be calm, to be engaging. And I think when you come in already stressed out and worried or frustrated, it makes it harder to engage in any of these skills, not even enjoy. It's going to be hard for you to praise that child and to notice what they're doing right. I think for me as well, when I'm upset, when I'm frustrated, I'm more likely to see like what my dog is doing wrong rather than like, good job, you're staying in your spot. So we definitely want to make sure that we take some time, refresh, regain the inner balance, as it says here, and then we're able to enjoy. And when we talk about play with our children, this really doesn't have to be an hour-long session. I know a lot of us, are either balancing working and in school and a lot of things going on at once. And I think it's just really dedicating some measure of time, even if it's 5 minutes at first with your child, just to dedicate some special time with them and enjoy the time with them, right? And what you're going to do during this time, you're going to model those positive emotions, smiling, enjoying. We're going to increase the child's interest in the play. This is really what furthers the warmth in the relationship, right? So I had a parent that I worked with her child who really, in the beginning of the sessions, had a hard time connecting during play. I feel like mom was in one place and not really engaging, and then the child was doing her own thing. And it was beautiful to watch as she continued to master all the different pride skills. When it came to enjoy, it was a little awkward at first because she wasn't in touch with the childhood piece, and she didn't really have a repertoire for play. But with practice, she felt comfortable and she was able to enjoy and laugh with her child and engage. And I think for me as a therapist, my role in that moment was to highlight the enjoyment between the two of them, right? So, wow, I see you and mommy are having such a good time together. Just modeling that for the parents until the parent herself started sharing and telling her daughter, wow, sweetie, this is really fun. I'm having a fun time with you. And then this is also going to reinforce those desired behaviors. So whether it's not throwing the toys, staying seated, being able to take turns, share, And some examples of this, like I said, smiling, eye contact, an arm around the child, maybe rubbing their back, whatever the child feels comfortable with. Again, the parents are the expert as to what the child enjoys. We want to make sure parents, again, that warm voice, laughing together, clapping, and then again, highlighting and verbalizing to your child, I am having so much fun with you. I'm having such a good time playing with you. Really letting them know that you're enjoying it. So here I have some discussion questions that I'm gonna take a couple minutes and talk about. And so here I want you to think about, how do you see parent mental health influencing their ability to use pride skills? So I'm gonna take a minute to reflect on it. So here, in my experience, I think, and I mentioned this in the previous slide in terms of stress and whatnot. We all face stress to some extent. And I think when we have an added layer of maybe mental health, whether it's a parent who's depressed, a parent who's anxious, a parent who's really struggling in terms of their own mental well-being, it's going to be harder for them to engage with their child. These pride skills is going to be a little more difficult for them. And that's why I suggest those extra side sessions where they can have that time to troubleshoot with you and really role play and work through that. The parent that I mentioned previously, she suffered from depression herself, and it was very hard for her to engage with her daughter. Even in affect wise, it was hard for her to smile at her daughter, to engage and share. And I think with a lot of practice in our role play, and of course the parent, if they're seeking their own mental health, that helps too. But with our role play, she was able to master those skills. And then, so it is going to be challenging, but it's doable. The next question: what challenges may arise for the parents when learning and practicing pride skills? So take a minute to reflect on that. What challenges may arise for you as a parent, or when you're teaching a parent these skills? So this is going to vary from parent to parent, okay? Some parents, like I said, they go through all these skills and this is quick. Some skills are going to be a lot quicker than others. I've worked with parents where we get to the first skill of praise and they're like, I already do that. We're good. I already know how to praise. So you want to make sure to still take the time to go through and review each skill, even if some of them feel comfortable already with them. But then on the other side of things, I think, really exploring what the parents' level of comfort is with play, and really psychoeducating them on what it is that we're asking them to do during these sessions. Again, a lot of times you're going to have to explain that you might not be able to take the lead. Like, this is not the place for you to tell your child how to play. We're not working on the ABCs right now. We're just playing and just really explaining to the parent that we're trying to enrich that relationship, and the way that they would engage and play before is going to be very different from what you're going to teach them. So really just taking the time to work through those challenges, whether it's, engaging in play themselves, if they feel embarrassed, if they feel shy, having certain expectations of how quickly their child is going to change in terms of behaviors. I've worked with parents as well where they're doing the skills and the behaviors are still present. Mind you, they've decreased a little bit, so really just taking the time to psychoeducate as far as how this is going to impact the child and how this is going to look differently for all children, right? And then the next question: how would you approach teaching the enjoy skills that some parents may perceive as a basic parenting skill? So take a minute to reflect on that. So here, I think I asked this question because a lot of times I've had some parents who are like, you're trying to teach me how to have fun with my kid. I know how to do that. And again, this is something that seems very obvious when we talk about enjoying time with our child. But what you want to make sure and let them know is when we're talking about enjoy, it's really just engaging with them at a level where there's really no rules, there's really no constructs. It's not, how do I explain this? Like, we want them to be able to enjoy the time with their child and reflect that back to them. I think that's what it is, because a lot of times parents, you know, well, I know I'm having a good time with my child. Okay, but does your child know that? And a lot of times, you know, kids like to be told too, right? That their parents are having fun with them. And so, yeah, so I think in terms of approach, we want to be very gentle. We want to be very careful as far as how we discuss the enjoy skills, and just reminding them that this is something that's important to enhance that relationship with their child. And if they already have a certain enjoyment, I think that's great. I wouldn't be opposed as to like, okay, great, you know, you're already engaging in this, let's see what it looks like. And then going into the session and giving feedback in the moment. Next question, when thinking cultural differences and factors, are there any modifications, considerations you would make or have? So take a minute and think about that. So when we think about cultural differences and certain factors, you know, I'm thinking about working with, you know, any kind of background, Hispanic individuals, African Americans, people of color, people of a different religion. You always want to make sure as you're introducing each skill and checking in with them that this is something that they are okay with, that's something that is in line with their beliefs, in line with what their parenting modality, because sometimes when we're thinking about cultural differences and factors, it might not even be flat out culture. It might be just the parental expectations, right? And I've worked with parents where, you know, they are the authoritative figure. They cannot be seen as this like fun and carefree, like, and this person who is just having a good time. They need to be in control of the situation. So really, you want to be very gentle in exploring as you're introducing each of these steps, what this is like for them, and being able to respect those differences and work around it, right? So, you know, and being able to decide, is this an appropriate therapeutic intervention for them if they really can't agree or can't really modify all of them. And as you can see for some, so when you think of praise, certain cultures might not be used to praising. And I think some feedback I've gotten from certain cultures is, well, I don't tell my child, like I don't usually tell my child when they're doing good. That's not something that I do. That's not something that I see myself doing. Okay, how else can you show them? What are you comfortable with? Oh no, I can give them hugs. I can get, okay, and you work with the parent. You want to meet them at where they're at, right? And for those parents who are watching this, you want to take that into consideration as well, that everything I've discussed today, I haven't really discussed the different differences that your culture or your beliefs might be differing with what I've presented today. So you really want to be able to use these skills and modify it to what you feel comfortable with. So let's talk a little bit about the do skill, right? And this is, we want to ignore. And here we want to, when I talk about ignore, I'm thinking ignoring as in like we're pretending it's not there, right? We're not going to look at the child. We're not going to smile. We're not going to frown. We're going to make no contact with the child. We're going to be very silent, right? We're going to ignore the behavior every time it happens. And what it's going to do is you're going to ignore that inappropriate behavior, right? Again, unless it's dangerous or destructive. So I'm not saying ignoring throwing of objects, self-injurious behaviors, elopement. So we don't want to ignore safety concerns. That we definitely want to be able to redirect. But if it's something like whining, crying, you know, maybe not sharing, not taking turns, being bossy, things that we don't deem as a safety concern, or you as a parent or don't deem as a safety concern, I would go ahead and follow these steps to ignore. And what I want you to understand, and what your parents should understand, is the behaviors will definitely go up at first. And this is what we call an extinction burst, right? So for example, with my dog, you know, I'm eating dinner and my dog likes to beg for food. He likes to sit by me and he whines and he cries and he pouts. And, you know, maybe at first it was cute and I was like, okay, all right, I'll give you a little bit. But now it's like, okay, I need to start eating on my own. And he needs to go somewhere else. So what am I going to do? I'm going to ignore that. He's going to sit next to me. He's going to whine. He's going to pout. So first it'll be like a, and I'll just ignore, again, not looking at him. Maybe I'll continue eating. I'll continue doing, I'm going to be very silent. And then it'll progressively get louder. till he's barking at me, he's yipping at me, he's maybe pawing at me. So again, as long as he's not hurting me or hurting himself, I'm going to continue to ignore. And again, this is going to increase. And what I've noticed has happened in the past is if I continue to ignore, again, the extinction bursts. It gets so much that it just bursts, and then it goes back, and then it goes down. So you want to make sure parents understand that the behaviors will go up, but they will, eventually go back down. So ignoring my dog, okay, he'll yip, he'll bark, and then he just walks away because he knows I'm not going to attend to him. I'm not going to give him anything that he wants. This is going to help your child notice the difference between your responses to good and bad behaviors. So when we think of the pride skills, right, we are highlighting the things that they're doing, whether it's praising them, describing them, imitating them, or even just enjoying with them. So how do they know what they're doing wrong? We're going to ignore them. We're going to make it very clear that this is not okay. I'm not going to engage with you. It helps the parents stay calm, right, and not engage in that power struggle. It avoids increasing those attention-seeking behaviors by removing your attention, right? So when you think of my dog, I'm not giving him attention, so he's no longer going to look for it. So here's some examples. Look at the own toys, talk about the own play. You can avoid eye contact with the child, have a neutral body language, avoid talking to or responding to the child, increase the level of the current play to kind of shift the square, introduce a new toy or activity. So now the child is playing roughly with the toys, right? So the parent says nothing, turns, focuses to own toys, making it fun. I'm going to make some cookies. Oh, they're so tasty. So kind of focusing on their own thing and ignoring the rough play. So here are the don't skills. So here's what we don't want to do. We want to avoid giving commands, right? And again, this might be hard for some of us. For some of us, we find it easier to tell children exactly what we want to see. But what happens when we give commands? It doesn't allow the child to lead. And remember, this is the child-directed interaction. It creates those power struggles between what you want versus I want. It provides an opportunity for conflict and negativity, which is almost the opposite of what we're trying to do with the enjoyment and all the other skills. And it distracts from the positive moments during play, right? So here's some example. You could say, putting that block on here. These are some examples of how to give commands. Let's play with these toys. Look at, so we want to avoid saying things like this. We also want to avoid asking questions. And again, in my experience, I've worked with parents who, maybe children who don't have a lot of speech, and it's very silent. They end up asking a lot of questions, or even, again, that fine line between teacher and parent, where they want to make sure the kids know their colors, the animals, and the play ends up being less about like the animals are crossing a bridge versus what animal is this? What color is this? What it almost controls the conversation, right? It also makes it seem like you're not really listening to the child, or you're disagreeing with them. And then the kid's going to get frustrated, right? Because you're not listening to them. You're so focused on asking them questions that they're like, what's going on? I'm frustrated. And then it can create a feeling of failure if there's a wrong answer. So if the child is answering you incorrectly, there goes the enjoyment. Now they start feeling bad about themselves. So we want to make sure, we're not asking questions. So here's some example. What color is this? What are you making now? Why did that happen? So on and so forth. We also want to avoid criticizing. And I think this, again, is another one that's very hard to role play. It's very hard to discuss with parents from certain cultures. This, again, might be something that's hard for us to not do, right? So when we're criticizing, it really doesn't provide any direction to the child. We're not really letting them know what we want them to do. We're kind of just highlighting what they're doing wrong. And that's the opposite of what PCIT, the pride skills, are. It focuses attention on that negative behavior, right? Children burn out on these words, so it makes them ineffective. And I've seen this so many times where, we continuously tell children of how they're doing something wrong, and at some point they kind of lose interest in knowing. And then again, it can trigger the negative behavior. So either that power struggle or tantrums or whatever it is, the non-compliance that you're trying to work on through PCIT. And again, some examples: you're being naughty, I don't like it when you talk back, don't scribble on your paper. No, honey, that's not right. So just, we want to avoid, these are the don't skills. We want to avoid doing these. We also want to avoid or limit these words, right? No, don't, quit, stop, not. And I'm going to be honest, this is hard. This is very hard. I think a lot of the times it's easier for us to, again, focus on the negatives that our children are doing in session or, you know, in the home. And it's easier for us to tell them to stop doing something than what they're doing right. So it's almost like shifting the way that you see your child's behaviors, like taking off one set of glasses and putting on another one. And with that, it comes dropping these words that we're using with our children. So some discussion, some reflection questions that I'm gonna leave here. So what comes up for you when you think of ignoring and avoiding a child's behavior? So I'm gonna have you think about that for a minute, for a few seconds, okay. So what comes up for you? So some of the common responses I've gotten from mental health therapists is, you know, is I feel bad, I don't wanna ignore them, right? Or I don't want to avoid the child's behavior. I mean, not avoid, sorry, ignore the, you know, poor child, I don't want to ignore them. And then some parents might think, well, I'm letting them get the upper hand if I ignore them. I'm letting them know it's okay. And again, this goes back to shifting that mentality of, you know, teaching them what it is they're doing wrong through ignoring, rather than giving them the power to feel like it's right. And when we start paying more attention as to what they're doing wrong rather than ignoring them, that's when we're giving them the okay. That's when we're letting them know it's okay. So what challenges may arise when teaching these skills to parents? Again, ignore and avoid, you know, I think I've talked about it throughout, but I think it's just being mindful of the difficulties in certain areas for certain parents, where for some this might be simple. It's like, okay, I won't say it anymore. And for others, it might be a little bit more work, a little bit more role plays with them and working on that. So let's talk a little bit more on praise. I want to circle back to praise, right? So why is it important to praise? Oh my goodness, praise is so good. And as we know from the literature, positive reinforcement is the best. Like, it is so much better than timeout. It's better than removing things, because kids are more likely to do something when they are given something in return, right? So here, when we think about praise, we're technically giving them something, right? We're giving them either a good job, high five, and so forth. So we definitely want to consider praise in terms of being able to increase the desirable behaviors. And also, praise helps your kids feel good about themselves. They're going to feel like, wow, I'm doing such a great job, and it's going to help with their self-esteem. So the next portion, in what ways can you praise others? And then for this one, you know, again, there's so many ways you could do this. You could do this verbally. You know, depending on the relationship with the child, if this is a parent with their child, they could use physical positives, right? So smiling, looking with the eyes, hugs, kisses, sitting close with them. There's so many different ways to praise children. I think I have a slide. I know it says let's practice, but I just want you to take a look at all the behaviors to notice and describe and praise. So just to take a few in consideration, you know, we can notice that a child is doing something quickly, you know, like, thank you for picking up your work quickly, right? If someone is doing something gently, and I hear this a lot with very young children, that, you know, parents become frustrated because their kids are rough, and they don't understand what gently means. And I think in one step, it's teaching them what gently looks like, but as the kids are engaging in it, they start to learn the difference between gently and rough. So, wow, I like how gently you're petting the bear, the toy bear. Quietly, right? So I love how you're sitting down quietly. I've seen a lot of teachers use this one. You know, if safety is a concern, and like how you're safely closing that door. I love how you're softly talking to me right now. So we want to make sure to let them know what it is that we like. So good job in concentrating today, concentrating on your schoolwork. So we want to make sure to use these. And again, these are the helpful resources that I've used today. So this is the link that you're going to follow, the pcit.ucdavis.edu/forms/CDI. And what you'll see is, and I took a little screenshot of it here, is it's going to be, and if you look down here, it's going to be the Pride Skills handout. So I think I want to say it's 3.5. And if take a minute and like look through this website, because they also have resources in Spanish as well, and they have videos. So it's a very good resource to follow. Okay. And then, you know, of course, if anybody has any questions, you know, feel free to refer to the PowerPoint presentation, the website, the UC Davis website. I appreciate you all for taking the time to look at this video, and I hope that it was very helpful to you all. I want to say thank you for taking the time to sit with me during this time and discuss the Pride skills, the PCIT Pride skills in depth. I appreciate you all. Thank you so much. I'm going to go ahead and stop sharing. Thank you, everyone, so much. Goodbye, everyone. Be well.